Hi, I'm Dr. Mikulics, and today we're going to be talking about gluten sensitivity and your hormones. So many of us may not particularly think that gluten intolerance or sensitivity and estrogen would have anything to do with one another. But in fact, they definitely can affect one another. So we have about 3 million Americans who are affected by an extreme genetic intolerance to gluten, and that is called celiac disease. This is pretty rare, and most people who have it don't realize they do. However, we have about 18 million Americans who have a form of gluten sensitivity, and this is where the bigger problem lies. So with gluten sensitivity, people may experience, diarrhea, bloating, just not feeling quite right after eating a high gluten meal. Well, what is gluten, you might be asking? Gluten is one of the main proteins found in wheat, and it can have a bit of an inflammatory effect on the bowel. It's even been explained as kind of causing damage, a little trauma to the bowel in certain individuals. The good news is the cells of our intestine repopulate and replenish themselves every 3 to 5 days. So for most of us, we can have gluten once in a while and move on. But other individuals are particularly sensitive to this, and or maybe they have several factors causing inflammation and poor health along their gut wall, and the gluten is just too much. So getting back to how this can affect estrogen levels, well, much of our hormone regulation is mediated by enzymes that are created by the healthy bacteria that reside in our gut. So this is one possible link by which your estrogen levels can be affected by what's going on in your gut, specifically a gluten sensitivity. And you may be experiencing, just hormonal imbalances, irregular periods, and things of that nature. So, good news, there are 3 simple things you can do to see if this might be an issue for you. One, you can try an elimination diet where you eliminate gluten from your diet. Sometimes a week is enough to do it. Other times a couple weeks is required. It is important to read labels because it's just not wheat and pasta that can harbor gluten in its content. So certain types of soy sauce and dressings and things like that. So give that elimination diet a try. Second, there's a simple blood test called the TTG blood test that if you're really having problems, your doctor can probably order that for you. And then third, you guessed it, eat the rainbow. Support that healthy microbiome, support lowering inflammation in your gut, and support, with increased fiber from that healthy rainbow diet, proper elimination, so that your intestines and your microbiome can do its best job for you and regulate your hormones properly. That's it for today. Thanks.